Good evening, everybody. My name is Suvendrini Kakuchi, and I'm a member of the club. I'm a journalist and member of the FCCJ. So welcome to the FCCJ. And this is just one of our evenings of the deep dive events, which is a new series in the FCCJ. And these series are actually aimed to kind of look behind the news. So we're looking at the deeper issues of the news we see on TV and read on the headlines. I just would like to introduce the head of Deep Dive, which is Anthony Rowley. He's an esteemed journalist, and he's here today. And we have the deputy, who is Keiko Packard, over there. She represents the associate members of our club. So it's a combination of journalists and associate members that are doing these series. Today we have a very timely topic. It's the mental health issues stemming from COVID-19, and the data shows that we've got very high cases of mental health issues, and that more people are seeking help for anxiety, depression, and this could be related to lockdowns and the social distancing that seems to be, has been part of our life for over a year now. The other data that is the reason why we wanted to look behind the issue of mental health is the fact that more women than men are being affected. So we will get our speakers to talk about that as well. So also, I've just been doing a story. I've been looking into a story of more young people, like university students, just dropping out of university because they can't stand the social isolation and the online news. So we'll talk about that as well. And of course, the medical workers, I mean, they must be going through such a lot. And I think we are already seeing the repercussions of that. So before we get the whole session going, let me introduce our speakers. On my far right is Vickie Skorji. She is the Lifeline director of TEL. TEL, as far as I know, is very famous in Japan. Does a lot of work on mental health issues and suicide prevention. So Vickie is from Australia, I think, and has been in Japan for a long time. And the next speaker would be Professor Haruka Sakamoto, who's I've actually interviewed quite a lot for my stories. She's going to present us with some research, latest research on the mental health issue. And then we have finally Sachi Nakajima, who is the head of resilience. It's an NPO that is very, has been working very hard on training, trauma training. So she works with various sectors in Japan to raise the issue of mental health and how we deal with um, this issue in Japan, which is not very, open to the whole acceptance of mental health. So I hope the I hope the internet supporters of the evening are ready. Okay, Daijabu? Okay, all right. So we'll start with a quick round of self-introductions. And Vickie, would you like to go first? Yes.
Yes, hello everyone, and thank you very much, Keiko, for inviting me here to speak to everyone tonight about mental health. Uh, my name is Vickie Skorji, and I am the Lifeline Director at TEL. And TEL is a member of the Federation of Inochinno Denwa that has been supporting the community since 1973. My background is in psychology and neuropsychology, and I've been at TEL in many different capacities, from a volunteer on the Lifeline, a therapist, and now I'm running the Lifeline. So that's just a little bit about me. Thank you.
All right, thank you. And then Sachi, can you go next?
Sure. Can the PowerPoint go up a little bit? My name is Sachi Nakajima, and I run a small nonprofit organization here based here in Tokyo What we do mostly is to go around Japan training people of all different backgrounds, whether it be ranging from general population into school settings, professional training, juvenile prisons, in all kinds of areas about trauma that's based in human relationships, whether that be child abuse issues, sexual violence, domestic violence or slash intimate partner violence, dating violence in schools. That sort of subject is what we do here in Japan. Because of COVID, a lot of that has moved online. Most of our work is done in Japanese, so this is kind of an exception that I'm doing this in English. But so that's what I do.
And,
Thank you
and
for
how,
having me today.
and how long is that? When did you start Resilient?
2003. So we've been around a little bit.
Yeah,
Thank
so
you.
you probably know a lot now. Yeah, thank you very much. And Dr. Sakamoto? Yeah, a
Hi.
little bit about yourself and then it's just a self-introduction.
Okay.
So.
Okay. Yes. Hi. Nice to meet you, everyone. My name is Haruka Sakamoto. I'm currently working at the Department of Health Policy and Management at the Keio University. So my background is a primary care physician, and I used to work as a home visiting physician in Tokyo and then some remote area in Japan. But then several years ago, I moved to the academic institute, and then I'm doing a research about the public health. So currently, my main research topic is all about the COVID-19. So research in the COVID-19 itself, and then also as I'm an expert in the public health, so I did some public health issues, including the mental health and suicide, domestic violence, and child abuse. I'm doing that kind of research.
All right, thank you very much. I think we will now have the speakers introduce their research experience and any comment they have on what's happening right now. Let me start with Vickie, your presentation.
If I could have my presentation up first, please. So maybe my next slide, the next slide. So that's just a little bit about TEL as an organization. As I was mentioning before, we've been around since 1973. We started off as an English language lifeline, but in 2003, the people that called the lifeline, over 50% were Japanese. So that's at the height of the suicide pandemic, if you like, in Japan. We also have a clinic, and our clinic has expanded to many prefectures around Japan. Could I have the next slide? And we also do a lot of outreach activities to the foreign community. So can I have the next slide? So what I want to talk to you a little bit about tonight is just setting the scene about mental health, because there's been a lot of talk about mental health and COVID-19. So first of all, when we think about mental health, we know that about 1 in 4 of us will experience a mental health illness at some point in our lifetime. And often when we think about mental health, we think about that as somebody who's not capable of working. But in actual fact, 1 in 5 people in the workplace will have a mental health problem at any given year. And when we think about mental health, there's been a lot that's been talked about youth mental health issues and COVID. 50% of all mental health problems happen by the time we're 14 and 75% by the time that we're 24. So the onset of mental health issues happen when we're young. We were already seeing an increase in mental health issues before we had COVID-19, and COVID-19 has exacerbated some of those issues. So it's important when we think about mental health, it was already on the increase in many demographics. So COVID-19 has kind of exacerbated some of those issues. So could I have the next slide, please? What we do know from lots of research in previous other disasters, and TEL was very involved in the rollout of psychological first aid following the Tohoku earthquake, is that there's a set pattern that happens in disasters. And in the first 12 months or the initial period of a disaster, there will be an uptick in mental health issues. And we are all experiencing that at the moment, if you like, not so much a mental health issue, but that stress. And it's called a traumatic stress response. And every single one of us is experiencing that. And perhaps like in a war, we're experiencing it across the globe. And each country is dealing with it slightly different. And so if you're a foreigner in a country, you're going to be a little bit conflicted with some of the mixed messages that you're going to hear from what's happening within your country and maybe what's happening from without your country. So we know that there's a set uptick in the initial phase. And we kind of all saw that right around the world. When we had a kind of our first lockdown, everybody rushed out and bought toilet paper. Whether you need it or not, so many people rushed out and bought toilet paper, flour, whatever they thought it was, right? You didn't have any control over the situation, but you felt you needed to do something and you went out and bought supplies. Now, when we have a state of emergency, nobody's rushing out to do that because we've kind of adjusted to it. We also know that around 15 to 20% of the population will go on to have ongoing mental health issues post the pandemic. We're not post anything at the moment, we're still in it, right? So we know that there will be an uptick, but we don't know exactly which populations are going to be affected. At the moment, we know that youth and women are being affected primarily at the moment. So it's important when we're talking about mental health issues that we think about what we already know within a pandemic. So we know that this is going to happen. Can I have the next slide, please? Okay. Already in Japan, we've seen an increase in suicides. And primarily we've seen this increase within young people and within women. But as I was mentioning before, that is the demographic that's been impacted at the moment. Although that's been an increase, it's also important to remember that a large percentage of those people that took their lives were men and elderly, right? So the increase has been dramatic in young people and women, but you've still got a large number of men and elderly people taking their lives, right? It's just not where we've seen the increase, okay? So when we move into the post-pandemic phase and we're starting to see the impact of businesses, we might see the demographics changing, okay? So it's important to think about what we're seeing now and what we may see in the future, okay? Can I have the next slide? So when we're talking about young people, these are some studies that are from, one's from UNICEF from last year and a few of them are from here in Japan. So you can see that there's that general sort of image that's going on where young people are saying, I feel particularly anxious and worried. So you'd expect people to be feeling anxious about a pandemic and you'd be expecting them to feel anxious about the future, right? And that you can see that women in particular in those countries, which was reflective of what was going on in Japan, young women were more pessimistic about the future and more anxious about what was going on and more impacted than young males, okay? And already, as I said, we saw that the suicide rate in Japan increased in young people and it increased in young women, young adolescent women, right? And then the last one I've got there is some research that's done within university students in Japan. And again, you see that increasing rate in, this time they're talking about anxiety and depression. Now, what happens with anxiety, if that is not treated, it goes on and it often has a very high comorbidity, or if you like, doubling up with somebody going on and getting depressed. So when I'm anxious, if I don't get treatment, I start to feel really like I'm a failure and I'm not doing very well and I'm not coping. And that can lead to someone getting depressed. So if we don't treat anxiety, it often flows on into depression. And when we're depressed, we feel very hopeless about the world. We feel that there is nothing positive and we can't see any future. And most people who are depressed will have thoughts of suicide. And if they don't get treatment, they can end up taking their lives. So if you like, there's a lot of research on suicide, but suicide is an outcome of an illness that's not treated. Okay, so that's what's going on with young people. Can I have the next slide, please? When it comes to women, the studies are saying that women in particular have been impacted at the moment greater than males because many of the industries and the jobs that they did have been impacted by the pandemic. So women are more likely to be in part-time jobs. They are more likely to be carers, so nurses, part of the aged care industry, supporting care in caring roles, supporting elderly people at home. They're also more likely to be part of hospitality and the tourism industry, and those industries have been hit severely by the pandemic. So the employment opportunities of women have been impacted. Not only that, relationships have been under increasing stress, and that has led to either divorces. So we saw in April in Japan a huge divorce rate that was going down, and huge increases in domestic violence. And Sachi's going to talk to you more about those sorts of issues, right? So we've seen those sort of upticks that are going on. But what's really interesting that these studies are saying that both with the young people and with the women, even if they had a mental health problem, they wouldn't reach out for support. There's a first study that I've got up there is from a non-profit organization in Japan that's supporting women, trying to empower women get back into the workplace. And that first statistic that it's got up there says that 90% of women in Japan felt that they were jealous of men. And the reason that they expressed that they were jealous of men was they felt men had many more opportunities than women in Japan, right? And that they felt that very little had been done towards addressing the gender gap in Japan, which you can see down at the very bottom there. This year, Japan is still ranked 121 out of 156 countries. And that many of them expressed that they wanted to get a job, but felt if they did get a better job, that it would impact their spouse or their family situation, and felt that they wouldn't get that support. The other thing that many women were experiencing, whether they were working women or single mothers, they weren't getting that support when the shutdowns happened. So they might have had a spouse at home, they were dealing with schooling at home, and they were maybe going to work, or family members as well, and they're having to do all of that, and they were picking up the largest share of all of those domestic issues, and that was adding even more stress to them, right? So again, you can see that gender study was saying the pressures on women has been significantly greater throughout this period so far. Can I have the next slide, please? So what's really important when we're talking about mental health issues is that both with the women and with the young people, and for all of those that end up taking their lives, is that they're not getting the treatment and the support that they need. And in Japan, there is less resources available to them. So in addition to less resources, there is also a lot of research saying that the stigma and the shame around mental health issues is much greater in Japan. So people are less likely to feel that they can speak about it and get the support that they need. They're more likely to feel that they are failing in some way, that they are letting people down. So the illness just grows, it gets stronger, and it's harder to fight against. Right? Additionally, counselling is not available on the National Health Insurance Scheme. So in Japan, you can only get support on the National Health Insurance Scheme via a psychiatrist. And psychiatrists are inundated and they can't manage the demand upon them. So they are often forced to treat the person with medication, heavily with medication, and less with the skills and that counselling support in Japan. If you are to get counselling, you're going to have to pay for that, and that's not cheap. So again, there's a kind of like that income gap, if you like, in accessing support for your mental health issues. In addition, because this topic is not talked about very much, parents and educators are also not trained in it. And if you think about the fact that the majority of mental health issues are happening when you're young, it's critical that parents and educators know how to address and support these issues so that they can nip them in the bud and people can go on and have a healthy future, right? So having that training and that support, parents would all know what a physical health problem was, but very few would know what a mental health problem looks like. Right? So when you have a disaster, it's even more critical that parents and educators who are going to be that stable influence to young people have training in mental health issues and know how to build resilience so that they can become stronger. And I guess I've got something there about those limited resources. So I'm not sure where I am on time, but I'm okay.
Go ahead, yes.
Okay, all right. So maybe the other thing I want to put in here as well, that there's been a lot of talk about young people and about women, but also the research is coming out quite strong that a third of those who experience COVID-19 are also having ongoing mental health issues. Many of them that lost their sense of smell and taste, it has not returned, and it may not return. Many of them feel guilt because maybe a family member got it, or maybe a family member died. So that when we think about the mental health issues, it's not just those who are being locked in, or not doing the not being able to work or do those other things. A third of the people who have experienced COVID-19 have ongoing mental health issues. You know, we also know that those that are in the medical profession are exhausted and burning out. So it's thinking about all of the populations in a specific pandemic that are going to be vulnerable. When we had Tohoku, it was the elderly. When we have COVID-19, it's at the moment, we're seeing it in the health professionals, we're seeing it in women, we're seeing it in the COVID-19 people that have experienced that, and we're seeing it women, young people. Yes, I think that I've said all of them. Okay. So I guess I wanted to bring those issues up as well. It's not just young people and it's not just women. And maybe my last slide is that hopefully COVID-19 brings about change. Change in making all of us talk about mental health issues. We have all experienced the stress and the challenges of this pandemic. All of us have mental health. Those of us who are the well, who do not have a mental illness, should be advocating for those who are struggling with the illness. So maybe COVID-19 makes all of us rethink mental health and do something about it. So thank you.
Thank you. Thank you, Vickie. Thank you very much. That was really good. So we have the next speaker, Dr. Sakamoto. Yes. So we need her slide to come up. I think it's, yeah, okay, great. Now we can wait. Okay.
Yeah, thank you. Yes. Okay, so today I'd like to talk about the suicide in Japan during the COVID-19 pandemic. Okay, so next slide, please. Yeah. So I think many people have the impression that the suicide is common in Japan. And in fact, the suicide rate in Japan, which is the number of the suicide per 100,000 people, was 14.9 in 2019. So the OECD average is 11.3, which making Japan the seventh highest among the OECD countries. So the number of the suicide in Japan skyrocketed after the 1998, triggered by the so-called Asian economic crisis. And at one time, the number of suicide exceeded 30,000 per year. But in recent years, the number has been on the downward trend, decreasing by about 35% from the peak. So also it differs somewhat from the OECD statistics. The government statistics show that the suicide rate in the 2019 in Japan was 16 overall and 22.9 for men and 9.4 for women. So one of the features of the overall rate is that it is higher for the males, as Vickie just pointed out in her presentation. So next slide, please. So here is the trend in suicide by age group. So the darkest blue is for the older generation, those who were aged over 60 years. And then orange is for the 50s, red for the 40s, and green for the 30s, and then light blue for the 20s, and then the dark green for the teens. So it is a bit difficult to make a simple age comparison because the absolute number of the people in each age group is so different. But then basically, the trend of the suicide before the COVID-19 in Japan was that suicide was more common in the middle-aged and then older-aged male groups. So when combined with the previous slide, yeah, again, it can be said that suicide was basically more common among the middle-aged male in Japan. Okay, next slide, please. So considering these increasing trend of suicide in Japan, our group had analyzed the suicide trend by age and then sex to know who is at a high-risk suicide. So this figure here shows the monthly change in the number of suicide by age and gender. The straight line is for male and the dotted line is for females. I'm afraid it's hard to see, but you can see that there's a big increase in October, especially for women on the dotted line. Next slide, please. Okay. This figure also shows the difference between the number of the suicide predicted for the 2020 and the number of the suicide actually observed based on the estimates from the past suicide numbers. So upper blue is for male and then lower orange is for female. The straight line shows the expected rate of suicide in the expected suicide based on the past trends in the number of the suicide. In contrast, the dots shows the actual number of the suicide observed. Especially since last summer, the observed suicide rate for both men and women has exceeded the expected suicide rate. Next slide, please. These are the results by the age group. The top left is for people in their 30s. The top right is for people. Top right is people in their 30s to 40s, and then the bottom left is for in their 50s to 60s, and then the bottom right is for people over 70. We can see that among the younger male generation, the actual suicide rate represented by the dots is much higher than expected rate. On the other hand, among female, we can see that actually observed suicide rate exceeds the expected suicide rate in almost all age group. So for the male, we can see the increase mainly in the young generation, while for female, we can see the increase in almost in all generation. Note that the shadow behind the straight line represents the range of expected suicides. Therefore, if an observed point is within the range of this shadow, the increase or decrease will be in the predicted range. On the other hand, if a point is outside of the shadow, it means that the number of the suicide is higher than expected. So for example, if we look at men in the 30s and 40s in the upper right in September, the point is above the straight line, but not beyond the shadow. So this indicates that the number of the suicide among men in this age group was increased, but still within the expected range. On the other hand, in the same figure, when we see in the October, the dot is well above the line, which indicates that actual increase was much larger than expected. Next slide, please. Okay, so to summarize, Japan originally had a high suicide rate, but in recent years, it has been on a downward trend. However, with the recent outbreak of the COVID-19, the number has started to increase again. The increase is in particular among the women and the young generation. In fact, the number of the male suicide decreased by the 23 people compared to the previous years, while the number of the female suicide increased by 935 people compared to the previous years. However, again, it should be noted that the absolute number of the suicide is still higher among the male. And then it is also a serious concern that suicide are increasing among the younger generation. So compared to the previous years, there was 9 more elementary school students, and then 34 more junior high school students, and then 60 more high school students. And the total number of the suicides among elementary through high school students was almost 500, which was the highest number since the statistics began in 1978. Next slide, please. So next, I'd like to explain about why suicide has increased among women and the younger people. Let's start with women. So various studies are still in progress, and then there's no solid factor have been identified. Rather, it seems that the suicide among women is increasing as a result of the complex combination of the various factors. The first major factor is an economic reasons. So the many industries have been affected by the COVID-19, but the food and the tourism industries have been the most severely affected. And then these industries have been predominantly staffed by the women, especially the part-time female workers. So as a result of the severe economic impact, more and more restaurants and bars have gone bankrupt or downsized their services, and then many part-time female workers have lost their jobs. In fact, the number of women who lost their job last year was 740,000 compared to the 320,000 for men. Another factor may include an increased burden of the care and then domestic violence. So the closure of the school and the nursing home has increased the burden on women in the house. So this has been noted not only in Japan, but also in many parts of the world. So women are particularly responsible for much of this increased burden for child rearing and then the care for the elderly. It has also been pointed out that there has been a significant increase in the domestic violence, especially during the state of emergencies, due to the stress caused by the increased social and then the economic insecurities. So all of these factors, economic factors, and then increase in the care burden, and then increase the risk of the domestic violence, are thought to have worsened the mental health of the female, which in turn has increased the number of suicide among the female. Next, please. Next, next, please. Yeah. And then next, I'd like to consider the root cause of the suicide increase among the younger generation. Since the term young people includes everyone from the elementary school to junior high school to the university students, and I think it is necessary to look at the issue in more detail rather than simply lumping them in with a younger generation. So first of all, I'd like to talk about college students. And then I think the main cause of suicide among them may be the financial reasons and then less social contact. So they can no longer commute to the university because their parents could not afford the tuition anymore because of the economic depression, economic stagnation. And then also many of them were earning their living cost by working in a part-time job. mainly at the restaurant and bars. But the majority of the students lost of their job during the COVID-19 pandemic because most of the restaurants are closed. And in addition, almost all schools were closed and then classes were online. So for the college students, going to school is not only for the study or research, but another important aspect is to making a friend and then they enjoy their school life and then going out, eating out, doing the sports or doing the kind of activities at the school. But the COVID-19 has made all such activities impossible. So I think it is very easy to imagine that they feel lonely and then they are meaningless to going to feel like meaningless to keep learning at an online. I also think that the closure of the school has a great impact on the elementary to high school students. So it has been also pointed out from the recent research that there has been an increasing in the number of the child abuse since after the COVID-19 started. So I also think that the loss of the place for children outside of the home has placed a heavy psychological burden for those children, especially those who have a problem or challenges at their home. However, what we need to keep in mind is that last year, there was a report of the suicide of the popular celebrities in Japan. So it is often said that the number of the suicide, especially among the younger generation, increases after the celebrities' suicide. So therefore, I think we need to be very careful about the suicide among the younger generation. I think they may affect it not only the COVID-19, but also the report of the celebrities' suicide. So in conclusion, so suicide has been the main problem in Japan even long before the COVID-19. And then so the recent years, suicide has been decreasing in Japan, but after the COVID-19, we are now in an increased torrent of the suicide. And then although absolute number of the suicide is still higher among the male, but the recent COVID-19 particularly affected the female and the younger generation. Okay, thank you very much. This is the end of my presentation.
Yes, thank you very much. Did you do the research recently, or can you tell us a little bit about the background, like how you did the research, how long it took to get the data?
Do you mean the research
The
about
one
the
that you just
suicide?
presented, yes.
Okay, my research is about the straight and dot line, and then the expected suicide, comparison between the expected suicide and the suicide, number of the suicide actually observed. And then the recent research, we use the data only from the last years, but we now have the updated data by the March this year. So I'm now doing the updated research.
Okay, thank you very much. And then we have our Sachi Nakajima to talk about your training and other aspects. Thank you.
Can I start? Can you go to the next slide from the get-go? I think I'm just going to go really quickly on this because you can look up resilience online, except it's all in Japanese. I'm sorry. If you have questions, you can email me and I'd be happy to answer. And I think I kind of introduced myself as well as resilience at the outset. So can I skip the next two slides? Go to the fourth one, maybe. And so with the onset of COVID-19, we have switched a lot of our services into online services, and we do a little bit of online provision of discussions around trauma, I guess is what we do. Not heavily invested in that, but somewhat. Next slide, please. I'm not going to talk about, next slide, please. Hi. And the suicide, because it's been covered already today. But I just have to say that regardless of what the reason for suicide may be, I think there's one commonality amongst people who consider suicide, including myself, who have, is that when people start thinking about suicide or ending life, it is, for some people, the pure thought of wanting to end a life, maybe perhaps. But I think a lot of us who have gone through severe trauma, it's that the day-to-day living is just too painful or too hurtful. And so there's some of us who don't really want to die, but want to end this pain. And then somehow living is equated to living. And so, with that equation in mind, it is easy to arrive at the conclusion that we must end it in order to rid ourselves from this pain and to release ourselves from this pain. So when we start thinking about those things, we need to really, really focus on mental health, especially with all the information given already today on how severe the situation here of suicide it is in this country. It's probably global, but it is certainly here in this country. And why aren't we focused more on mental health, which is strongly related to what is happening in our society? Now, I'm not going to go too much into detail about domestic violence worsening in these times or child abuse worsening in these times, because to me, that's kind of obvious. If you're in an enclosed space with someone who is violent, then is the violence going to go away or is the violence going to get worse? I don't think it takes rocket scientists to figure that out. It's in front of us. And yet we're surprised. A lot of us in this society is surprised that all these things start to happen when we are in a lockdown or there's a global pandemic. I don't think we should be surprised. If we have time to be surprised, I think we should take that time to do something about it so that all these kids who are in an enclosed space, which is their homes, that they are exposed, they continue to be exposed to danger, or women or men, whoever it is, that they're not seeing hope because they don't see a way out. They don't see this ending. Then it's not the responsibility of that family to do something about it. I think it is up to society to recognize the importance of this issue and to do something about it, is personally how I feel about that. Next slide, please. So here on this list, on this slide is a lot of the emotions that are evoked by COVID-19, which overlaps with effects of trauma. So if somebody has been suffering from effects of trauma from the get-go previous to COVID-19, then the feelings that COVID-19 or the pandemic brings about feels very familiar because it overlaps. But a lot of us don't recognize where that overlap is coming from, or why is it that we are feeling so depressed or so hopeless or so powerless. And if we recognize that the causes are very different, if it's caused by a family member who's being abusive as opposed to an illness, a lot of people don't make that connection. But in fact, there is a very strong correlation. If you just look at, well, what happened? Well, it's okay. The slide before this one, there's a list of feelings. Like we can't foresee when this is going to end, right? None of us know when COVID-19 is going to go away. So I think that a lot of us feel like we're in this dark tunnel, just going and going and going, and we don't really know when we're going to come out at the end. Yes, there are vaccines, but is it available to everybody around the globe equally? It's not. So for some of us, it's very difficult to envision the ending of this pandemic. Social distance, it's a nice term to use. It's very convenient, but I think it's technically wrong to use social distancing because it's not about social factor. It's about the physical factor. So we should have started with physical distance from the get-go, because human beings, we are wired to be connected with one another. We tend to have mental issues when we feel a lot of loneliness, when we feel like we're not understood, when we feel like we're not connected to one another. So by focusing on social distancing, that means that people are scary. You need to keep away from people. And that's exactly the opposite of what should be happening in a pandemic, is figuring out safe ways to stay connected. And that, I don't think there's been enough done on that aspect. And then the powerlessness slide right there. Powerlessness is a feature of any kind of traumatic effect, whether the trauma came from abuse or violence, or whether it came from earthquake, any kind of natural disaster, a heavy illness, traffic accident, it doesn't matter. Trauma brings about a sense of powerlessness. That's a component of it. So human beings have a very difficult time dealing with powerlessness. We feel like we don't have control over things. So how can we help one another so that we can bring back a sense of power and control that is healthy in nature, not the abusive kind of control, but the healthy kind of power and control back into our lives? And that, I think, a lot of the hints lie in being connected to one another in a safe way. There was a little talk about shame and stigma already, but I'd like to add that shame is a big factor in our society, and we need to work on this. Shame is an emotion, along with guilt, that is only present when there is a human relationship. And that is different from other kinds of emotions. You could be sad, you could be happy, you could be angry all by yourself without having it based in a relationship. But shame and guilt comes only when there's relationship of some sort. So why is it that so many of us suffer from shame? Is because there's a lot of victim shaming in this society. Why is it that if somebody is raped, then we are so quick to blame that person for having gone into the perpetrator's house, or having gotten in that perpetrator's car, or having been dressed in certain ways? Why is it that we are not quick enough to call out the perpetrator first? Same thing with COVID-19, as Vickie mentioned. I'm not surprised that people who have gotten COVID-19 suffer, a lot of them suffer from mental health issues. It's because there's a lot of shame attached to that. They must have been doing something wrong. They must have not taken good enough care of themselves. That's why they got sick. This is not going to help our society heal as a whole. We have to stop doing this shame and blaming people for who they are or for what they have gone through. I think Brené Brown is the one that said that empathy is the antidote to shame. And empathy has to be in a safe and healthy relationship only. And shame is a very difficult topic. So when I do trainings on shame, I mean, like, not all empathies work great with all kinds of shames. There is a trick to that. But as a general rule, we must be more empathetic with one another in order to start cutting down on this massive shame factor that exists as an elephant in the room. Next slide, please. So there's a lot of things that we can't control in this pandemic, but there are certain things that we can do. And so I think it's important for all of us to know that the reactions that we may be having, whether that's a big reaction or small reaction, it depends on how you gauge that. But no matter what the size or how it gets felt, that that the reaction that you have is normal to something that is not normal. Trauma is never normal. It's not something that any of us want. So if we're going through something that's traumatic, it's not normal to us. So the way we react to that is in fact normal. It's important to also stay connected. I said that before, but if we can't do coffee as easily as we had done before, if we can't do lunches and dinners together, if we can't do get-togethers together, then we have the technology and the means to stay connected, like today over Zoom or other technology that's available on the internet. So how can we figure out more ways so that more people can feel that they are still connected to others? Like in Japan, there's a lot of death today. We're focusing, I guess, a lot on suicide, which is a big, important subject, but also kodokushi, right? Dying from loneliness. Why is it that there's so many people dying from loneliness when the persons who are dying are surrounded by people physically. There's somebody living next door, somebody living right by them, and yet they're lonely. Again, it's because people need to stay connected. And if people end up feeling like they're not understood, nobody cares about them, nobody's worrying about them. If I die, nobody's going to notice, then those thoughts already are part of mental health issues. And I don't really like to categorize everything as mental health issues because it's so diagnostic. It's like, ooh, it's like, oh, something that we don't know about. I just the fact that in the media, every day there's something about COVID, and it's usually something very negative about COVID. And yet, like the other two speakers have spoken, just in the month of October, there was more death from suicide than all those months put together during that year up until that point. Why is that? Why is not that more discussed? Is because COVID is contagious. Suicide, oh, it's somebody had mental health issues, so they died. It's none of my business. We can't do that. This is both important topics for a society, I think. Creating routines is important. Anything that might make you feel better is good. Routines is important because routines, when you have routines, you don't have to use a lot of brain power. Like before COVID, you got up at a certain time, you ate similar kind of thing, you left the house at the same time, you got on the same train. All this you could do on autopilot so that you could focus on other things in your head that was going on. Now that we have no frame for a daily life, it's like we have to think, what am I going to do today? I don't have anything planned. What am I going to do? That uses a lot of energy that drains us from doing our own day-to-day living in a healthy way, leading to possibly mental health issues. So it starts with small things. It may not seem important, but I think it is very important. Last slide, please. So I think personally, these are 4 factors that I continue to stress in a lot of the talks that I give, is that all of us need to feel safe. If our safety is threatened, then that's on our mind constantly. COVID-19 is on people's minds every single day. We can't get away from it. But if somebody is going through abuse at the same time, then both of those things are on their mind constantly. Think of the weight of that. If there's somebody in this room and the doors are locked and somebody has a gun and that person is brandishing it, what are you going to think about? You're going to focus only on that person because you need to figure out a way to stay safe somehow. So we all have innate reactions to not feeling safe. So one is to feel safe. The other one is to have hope, because like I said earlier, people who start giving up on life are beginning to lose their hope. So how can we create hope for one another? The hint for a lot of us is in our human connection. If somebody reaches out to you and says, "Are you okay?" That makes a difference. Maybe we can do a chat over Zoom. That makes a difference. "I'm thinking about you." That makes a difference. It's the small things that count, that we could do better, all of us. And then a sense of belonging. We all need a sense of belonging. If we're in our houses or homes not feeling connected, that home is probably not going to feel all that much of a place where you belong. So how can we create that? Again, it goes back to human connection. So those are some of my thoughts that I wanted to share with all of you today. More of a fuzzy stuff, not research-based, but this is what I do. Thank you.
Thank you for the presentations. So we have about 20 minutes for a discussion. And before I throw open a couple of questions, would anyone like to comment on either one of the speakers' presentations or thoughts? Vickie, do you find the research anything different to yours? Like, for example, the trends and the difference in numbers that Dr. Sakamoto talked about?
Maybe there was just one bit of research with the suicide that didn't come up. And that was around the increase in women's suicides in Japan, particularly I think it was around September and October. Around that time, I think we were mentioning about the celebrity suicides. But what was going on there was there were a number of female celebrities that took their life. And my apologies, I can't remember the name of the woman who took her life around September, October. But when her story was presented in the media, um, it was presented in such a way that there was this copycat effect. They weren't young women, they were women in their 30s. And following her death, 200 women in Japan took their lives in a 2 to 3 week period following her death. That occurrence that happens is called the Werner effect. It's been known for 50 years or more. There are World Health Organization guidelines on how to do safe reporting of suicide. Yet in Japan, the media frequently does not follow them. So those deaths are on the media's reporting and not doing safe reporting and helping women or any of them. When we promote or we talk about a celebrity's death, we have to do it responsibly because those deaths are not about COVID-19. That's about inappropriate reporting of those deaths. So maybe
Yes,
just
yes,
making that point.
that's a really important point. I think Sachi does trauma training. Do you have anything to do with the media, the training in media?
I can't say that I do. I don't know. I do this training in so many fields, but I don't think I've done some in media field. I just never even thought about that until I was asked that.
Right. Okay, good. Yes, yes. I think that's a area where maybe there's more work to be done. So just let me throw up a couple of questions. Since we're talking about Japan, and the message I got hearing the three speakers is that Japan is not doing enough on the mental health issues, particularly related to COVID-19. And I would like some comments from the speakers about how do you think the politicians have responded to, I mean, not just the vaccines, but the mental health aspects of COVID-19, if anybody wants to comment.
I think that's a difficult one. I know that there has been, the government has just created a Ministry of Caring. I think that's what it's called, to look into this. But, you know, the government's got so many issues on its plate, right? Mental health is one of them, right? I don't feel I'm an expert that could speak on that matter.
Yes.
Yeah. I think the government does provide some support for the vulnerable population, like the female or part-time workers and the children or sex workers. But I think in reality is that if they really reach out to those population, I think it's probably not. And then recently government said that they started to provide support for the female because of the findings that number of the female suicide has been increasing, but actually that those who committed suicide does not really connected with the service from the government. And then in that sense, I think government tried to do something, but I don't think that it's enough in an appropriate way. And then for the university student, this is one of the most concern. I because I'm coming from the university, and then I also affiliated in several other university in Tokyo. And then I compared my student life in the United States. I graduated from the school in the United States. So when I was in the United States, and whenever something happens, so school admin office often send me the message, not only to me, but for all the students, and then offering the mental support to all the students. But here in Japan, I think the very few school provides the mental support to the student if something happens. So not only for the COVID-19, but anything. So for example, like I'm still receiving the message from the university in the United States, and then recently I got the message from the university in the United States, and then offering support to the student from the Myanmar because of the current hostage in the Myanmar. or offering support to the Asian student because of the Asian hate crime happening in the United States, but no message coming from the school in Japan. But still, some students living in Japan are kind of feeling the stress and uncomfortable to seeing the news about what is happening in the Myanmar or what is happening in the United States related to the Asian hate crime. So I think the government support is not enough, but at the same time, I mean the universities, even the one of the biggest university or in some of the university in Japan does not really provide an adequate support, mental support to the student. But I think the university is the most closest to the student. And I think the university has a responsibility to support the student life, not only just providing lectures or research activities, but how to support and secure the student during their time in the college is, I think the university has some responsibilities.
Yes, thank you very much. I asked this question because I recall there was a question thrown at former Prime Minister Abe about domestic violence that was coming up quite a lot in other countries. And he said, no, 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 there's not many cases, but pressed by the media, he said, okay, I'll look into it. And I think that happened at the beginning when COVID-19 was coming up. And because, also I would like to also maybe have a few comments on the social aspects in Japan that could be different to other countries. I mean, houses are much smaller, and all of you mentioned that, Japan does not recognize mental health as much, and that is why we have so many cases in Japan increasing. So what are the peculiarities or the particulars in Japanese society that we really need, that is connected to the higher numbers of mental health that we see today? Vickie, would you like to go first, or that is contributing? I mean, in your counseling, maybe you see something among foreigners that cannot take the local.
I think there are many, many issues, just like the Japanese, the foreigners here have been struggling, and our Lifeline has not been able to handle all of the requests that's been coming at it. Around September and October, the calls to the Lifeline just went through the roof, right? As people were looking at a second lockdown or state of emergency, right? I think that when it comes to Japan and mental health, like I was saying before, that stigma and that shame. There's that attitude that if I've let anybody down, I've failed. And I think there's less education and awareness about mental health issues. We all have mental health, like I was saying before. We all have at times good mental health and at times not so good mental health. And if each of us are put with enough stresses and pressures, we can all get a mental illness. Just like if I was placed in a physical environment where I didn't get, where I was exposed to cold or whatever, I'd get a physical illness. And I hope that COVID-19 is showing us, with all of the stresses and strains, that we're all vulnerable. But mental illness has always been there. So it's about time, with all the internet information out there, with all the information out there, why is it that we as humans like to separate our thoughts from the rest of our body? Because there isn't a thought that doesn't happen that isn't physical. It's happening in your brain, and your brain is a physical organ, and sometimes it's not well. It's about time we all started talking about how to make our brains, or how to make all of us well. Within our young people, they are so disillusioned about the future. They are so anxious about the future. That anxiety comes from us, the older generations, and the pressures and challenges we have placed on them. So we need to talk about mental health. We lose 1 million people every year from an illness that we know how to cure. COVID, what have we done for COVID? to help save lives. Yet we seem to be okay at letting those other million people die without thinking about it. So I would like to see us address mental health properly. Mental health should be just health, like our physical health. Stop separating.
Yeah, can I also ask you when you receive these calls, do you work with foreigners in Japan only, or do you find a difference between the Japanese callers and foreigners?
We speak to anyone who will speak to us in English. And as I said, around 50% of those users are Japanese. However, since the pandemic, more of our activity has been via chat, which is with younger people, but less likely to be Japanese. It doesn't matter whether you're Japanese, whether you're old, or whether you're young. When you have a mental illness, you are all struggling. You all experience those same emotions of, like Sachi was saying, of loneliness, of shame, of disillusionment, right? Of thinking you can't get your way out of it, of thinking there is no hope. That is the illness talking. You can't ask a person with a mental health problem to think their way out of it. That is the problem. Yet that is what we ask of them every day.
Okay, do they give you actual reasons why they're calling you or why they feel like that?
Some of them come straight out and say, I want to die. Some of them say, I have a relationship issue and I can't go on. Some of them say, I don't have a job. Every reason you could imagine, they will say.
Okay, thank you very much. And then, Sachi, can you tell us why it's so difficult to speak out in Japan? Do you find, I mean, I don't know whether you have any experience doing trauma counseling abroad, but maybe because of your long experience.
Okay, but first of all, so nobody's mistaken, I don't do counseling. I do a lot of public awareness, so I do trainings. So um, I just need to make that clear. But um, what makes Japan different? Japan is not the only country, I suppose, but Japan does have a lot of issues with this issue of shame that I've already talked about. So if there's the shame factor, and Vickie and Haruka-san have talked about, um, the shame factor is that if we have something about ourselves that we feel that is not normal, then what is the term that would go with something that's not normal is often something like abnormal. And abnormal is bad. Some people connect being different to being abnormal. Then you have, for a very obvious example would be minority groups, whether that be sexual identity, sexual orientation, or ethnic differences, or nationality differences, race, class, all these things. If we feel that we are different, then often if that difference is not respected, then instead of respect comes along shame. And then with the shame attached, I think many of us start to try to hide the factor that causes that shame, whether that be your heritage, whether that be your disorders that you may have been diagnosed with, whatever it may be. And the fact that so many of us have to feel like it has to be hidden or not talked about, that is exactly the opposite of what we are trying to advocate today here. Vickie just spoke about the need to start a conversation. So so if a lot of us are hiding these things, then it's not even out in the open to talk about it, is it? And how can we have a safe place to talk about these things? I think it starts with whatever the community may be. It could be a household. It could be a classroom. It could be an office where people work. It could be any kind of setting where people gather. If that setting is safe enough, and if we are open enough, and if we respect one another for their opinions and their thoughts and their feelings, then conversations can start. I work with so many kids in juvenile prisons, and they're in there because they did something bad, yes. And some of them, some of what they have done is grave and serious. But regardless of what they have done, so many of these kids have been harmed by adults. So if I go in, they're not going to trust me because I'm an adult. I am an unsafe person in their history book. So if we want kids to seek out help from adults, and if they feel that adults are scary and bad and not to be trusted with, then we got a problem with the society. How can we present ourselves so that we not only appear as safe people, but be safe people? Are adults talking down to kids, ordering things, lecturing things? If we continue to do that, kids are not going to open up and talk about themselves. What we need to do is sit down with them, make time with them, listen to what they have to say without interrupting, without lecturing, without correcting them, and accepting what it is that they have to say. And then to continue the discussion without shaming them in any way. It starts with little things like not asking why. Why did you do that? Why did you not ask for help? There's so many of us that do that to one another. Why questions tend to be very threatening to a lot of us who have trauma. Why questions are often used by abusers when they abuse other people. Why are you so stupid? Why can't you do this? So how do we start a conversation with open questions, questions that are not based on whys, and questions that are based on listening? How can we train ourselves so that we can sit with silence if people need their time to start talking? Instead of trying to fill up that silent space, can we sit and stay with the silent moment for 10 seconds, 30 seconds, 1 minute? I think these are small things that are sometimes, they may feel big, but I think it can be doable to all of us, I think.
Thank you. Yes. And Dr. Sakamoto, do you talk to university students? Are they more open to talk about these things? Do they, have less concerns about shame?
I think it's totally depends on the students and then also the student where they are coming from. But in general, I mean, a Japanese student and then student coming from the Asian countries, they are more hesitate to go to the counseling room. And then at the same time, I think some university has a school counselors, but majority of the university does not have adequate number of the school counselors, or even they are not adequately trained. So in that case, I think just as Sachi-san explained that maybe the student does not really trust the school counselor, and or sometimes students are really uncomfortable or does not really, are feeling like not they are secure. So I think the culturally Japanese student and then some student coming from some Asian countries especially do not go to the school counselors. I think they mainly because of the cultural reason, but even they go to the go to the counseling rooms, but I think they are not every time. I mean, the school side does not provide the adequate counseling because of the lack of the training.
Okay, so you really don't see a difference between generations on the issue of shame that you've been talking about today.
Yeah, I think in Japan's context, I think yes.
Okay, right, thank you. And just finally, before I throw the floor open, we're talking a lot about Zoom as a way of staying connected. Well, I've been living in Japan for a long time, and I'm just wondering because I'm wondering whether how technology is really helping in mental health solutions, or because I've been reading that since since it's not very often that Japanese people really tell each other difficult things openly, and that technology is actually a way of being able to be more truthful to each other. So do you think Zoom is a better way for connecting in Japan at this time? Or, I don't know. I mean, it seems that even people don't speak to each other, even though they live in the same apartment building. So how does this, I mean, it's part of society and cultural, I think.
Okay, I think I go first.
Yes.
Okay, so I think I personally, I think Zoom helped me a lot. So my hometown is not far from Tokyo, and then I could not go back to my hometown for a long time. But still, I can connect with my parents or my grandparents with Zoom or any other technologies. But at the same time, today I did not mention anything about the mental health among the older population. So those who were living in the nursing care facilities, these people could not meet their families for more than a year. And then some long-term care facilities try to introduce an ICT technology, like providing an iPad or Zoom and setting up this kind of online meeting place. But it sometimes work, of course, but not every time. So I think that we need to be very careful about using the technology, especially for the older adults, sometimes expand the gap between those who have the connection to the internet and those who do not have. So when we talk about the health in general, like our socioeconomic status, like economy, education, occupational status, and race, these are also affected health status. And then ICT technology, access to the ICT, I think is also the one of the socioeconomic factors. So those who have a higher literacy and then highly educated, and those who have the family member who teaches you about how to use the technology, and that kind of person maybe are a benefit from the technologies, even during the COVID-19. But those who are not really educated and less educated, and then those who do not have no literacy to using this kind of devices, and then there's no family members who provides you about this kind of the devices or how to use, teaching you how to use this technology. In that case, that person cannot, I mean, getting any benefit from those devices. So I think of course, there's a huge potential of the technology for diminishing the gap and diminishing the social, the distancing, negative impact of the social distancing. But at the same time, we need to be very careful, especially about those who do not have an access to the technologies.
Sorry, any other comments on the use of technology in Japan to bring more connectedness?
Maybe I'll just say a little bit about that. Just like any maybe technology or it can be abused, and if it's overused, that can have a detrimental effect. So there is a lot of research that's saying that parents need to manage the amount of screen time that young people spend on these devices. By the same token, it has tremendous capabilities to connect us. And I think we have seen that during this pandemic. For myself, I have a family in Australia and I have a daughter in New Zealand, and Australia and New Zealand has very strict rules. So it might be some time before we can get together. So that has allowed us to stay connected. I have a father who has dementia, and so that has made it really difficult for me to see him or know how he was going. At one point, there was COVID in his nursing care home, and I was extremely worried about him, and people couldn't even get in to see him. So I was very grateful that I could at least be talking to other members of my family via whatever the technology, whatever the platform was that we were using. Later in the year, my mother was able to see my father and put him on, I think it was Messenger we were using, but it doesn't really matter. I was able to see him. He didn't really know who he was, who I was, but I was just overjoyed that I could see him. So I think there are many benefits that can come from it, but just like anything, we need to manage it and be responsible with it.
Can I add to that?
Yes.
So I too have benefited from having the internet connection to stay connected. That goes without saying. So I guess that's true with the both members of this panel. I have to say that it's probably not the greatest in learning environment for kids. Also for treatment, it is a substitute, and and I'm thankful that there is a substitute technology available. Whereas 20, 30 years ago, this substitute technology would not have been available. So yes, it is good, but it does not replace the original format. So in that sense, I would say those are two fields that serves the purpose, but it doesn't replace the original form. The third category that I have where internet is toxic is for those people who, going back to the first part of what I spoke about, those people who are in the same space with the abusers. How are they going to get on the internet if somebody is watching you 24/7? You are not going to be able to get on the internet and seek help or to get therapy or to talk to someone in a safe manner. So that could apply to anybody who's suffering from child abuse, domestic violence, any kind of abuse in that way. Another example of where internet is toxic is trafficking. And so many young people and kids are lured through internet into trafficking and sex crimes. So and it starts really benign for a lot of kids. They go online, they start buying things, they try to buy things, they try to stay connected, and they need to buy stamps for this line, for example. They don't have credit card registered, and somebody comes on, pops up on the screen, says, I can get that for you. That's how it starts. And are we monitoring our kids so that every interaction that they have on internet is safe? No, we don't have that technology or the wherewithal to do that. So yes, and maybe, and no to your question, I think.
Yes. So you don't see a future of everybody using technology instead of
I think we
meeting.
have to use it carefully.
Okay.
It's not safe. Convenience does not equal safety to me.
Yes, thank you. So
Maybe one thing I'll just say is that when it comes to like crisis support services, there's a clear preference in age groups between what users want to use. So 30 and older, they prefer a phone line. 30 and below, they prefer to use chat. So I think over time it may change. So younger people do not really call us, they like chat. That's their medium, that's the way they like to express things. And what is also interesting about chat is that they are more likely to come out straight away because you can't hear if they're crying. You can't hear some of the other things that might be ashamed about. They're more likely to come out straight away and say, you know, I'm thinking of killing myself. So there is an age preference in the technology that people like to use. So it may change over time.
okay, thank you very much. And now we can take some questions from the floor. Thank you, Anthony. Yes.
I'm Anthony Rowley, I'm a journalist. Just a couple of questions quickly, if I may. First one, a clarification, maybe I missed the point, but I'm not quite clear about how much the observations and data you've all been talking about apply to people who either have COVID-19 or have experienced it, or you're talking about people in general. In other words, the incidence of depression or anxiety or mental illness is much higher among the COVID sufferers, or are you talking about the population in general? That's my first question. And the second is, I know inter-country comparisons are difficult, but broadly speaking, are the incidence of these mental illnesses in this period of COVID worse in Japan than in other countries, or less bad?
Maybe I'll start off with that one. So the incident of COVID against the general population, I don't have the research on that. I do know, though, that the research is saying that 1/3 and possibly higher have mental health issues. So if I was taking a guess, it would be higher in that population because there's a greater population that has not had COVID. But I haven't seen the research comparing the two. When the second question you asked was Japan compared to other countries, right? So Japan is one of the first countries to highlight the suicide rates. That's because of it's been collecting that data ahead of other countries. So some other countries are seeing differences in the rates of suicide. So and many other countries we haven't heard from. So as far as the suicide rate is, I can't compare that to other countries, but Japan has seen that rise early, whereas some countries have not seen that increase early. In general, all countries are seeing an elevated increase in mental health issues, which is no real different in Japan.
Yes. Dr. Sakamoto, in your research, do you find a comparison with other countries, or you haven't done that, or I'm not?
Yeah, okay. I do not have much to add from the Vickie's comment. So about the first question, I do not have any clear number if there's any difference between the difference in the incidence of, among the COVID-19 patients and those, in the entire population. And then for the second point, yes, again, it's just a repeat of Vickie's comment, but yeah, in the global comparison, not only in Japan, but most of all the country experienced the increase in the suicide during the COVID-19. And then it's very difficult to say if the countermeasures in Japan is good or bad compared to the other countries. But yes, but I think every country has an experiencing the mental health issues, not only in Japan, but also all the other countries. And then most of the countries are struggling how to dealing with, because there's no sign of the convergence of the COVID-19. And then there's no positive sign. Some countries like in Israel and United States, they are starting the wider vaccination campaign, but most of the countries still do not have access to the vaccination, which means there's no sign of the normal life. So in those countries, I think they are struggling in how to combat the suicide.
Yes. Yes, please. マイクある？こっちに持ってく。これ持ってって。マイク。マイクだけ。はい。Yes, please. Yes.
Yes. Yeah, my name is Skorji, but I'm an associate member. When I was a little boy, we had quite some violence in the family, and most of the time, the main reason was between my mother and my father was about money. Now, that's why I've come up with a number of questions about money. We have all the analysis about, well, male or female age and so on. But do we have any statistics, for instance, among the people who have a regular job in Japan or people who are irregular, which makes about 40% of the Japanese population, who is basically in a very difficult situation from the financial point of view, from the very outing. But now the whole situation, of course, by the Corona has been even strengthened and to their big problem. And so that was my first question. Is there any data on that? The second one is also, how about the statistics about foreigners in Japan and Japanese in terms of, well, of course, considering the size of the population being quite different, but we can put that together. These are my, coming back on the government, I'd just like to add one point. Just about 1 year ago, the government paid out as a donation 100,000 yen to everybody. I thought that was total stupidity. What they should have done is to donate the money to the people who really need it. If you go 60 to 40, they would have got 250,000 yen, those who really need it, instead of, I mean, my family got 100,000 yen. We donated it for something different again, because we thought we are in no position to ask to accept such a donation. So what about this situation? What do you have any comments there? Thank you so much. And thank you very much for the whole presentation. It was really very interesting and very useful. Thank you.
Thank you, Kurt. Who wants to go first?
Okay, so maybe
Yes.
I go
Well,
first.
anybody
Okay.
who is willing to talk.
Okay, yeah, thank you very much for your question. So about first question, I think the infectious disease, not only the COVID-19, but infectious disease always hit the most vulnerable part of the society. So the if we see the tuberculosis, Japan is one of the endemic country in the world, but tuberculosis is not endemic or the population, but only to endemic among the poor household or foreigners community. And then again, the COVID-19. So COVID-19, I think everyone has suffered from the COVID-19, but they are not equally suffered from the COVID-19. And then the COVID-19 hit the most vulnerable part again in Japan. So like the sex workers or irregular employment. So if we see the suicide, especially among the female, the majority of them are irregular worker or part-time workers. So and then also not only the suicide, but worsening the mental health condition, like the depression or mood disorders or any other mental health condition, particularly worsening among those who were so-called vulnerable population, like the unemployment or irregular workers or those who do not have a job. So so the infectious disease hit the most vulnerable part, and then it causes the mental health problem, especially among those vulnerable population. And then to your second question about the comparison between the Japanese population and the foreigners, unfortunately, government does not disclose any data about the foreigners. So we have the data about the number of the suicide data for the entire population, including the foreigners, but they did not open to the nationalities about the suicide. So, but I think it's easy to imagine that, foreigners, living in Japan are, most hit by the COVID-19 because they do very difficulty to get access to the information. So for example, I think the majority of the foreigners, those who are not really understand the Japanese, do not know when the vaccination started in Japan or when they can get vaccinated. Or the very early stage of the COVID-19 outbreak, the government introduced a very unique policy about the PCR testing. And then we need to, if you go to the healthcare facilities, you usually get not tested. And instead, you need to go to the public health centers, or so-called hokenjo in Japanese. But I think it's very difficult for foreigners to understand why you cannot get tested at the healthcare facilities. Instead, they need to go to the hokenjo or public health centers. So those kind of information, I think the foreigners are very difficult to reach out those information. I think this is just one example. But so like I think it's very easy to imagine that compared to the Japanese population in general, I think the foreigners living in Japan are more, living in a severe condition, I think. But this is just my impression, and there's not kind of the scientific evidence or research findings.
Thank you very much. Any other, Vickie?
Maybe I'll just say that right around the world, they're seeing that different populations are being impacted, different demographics are being impacted, and definitely those that are of lower income are being impacted or single families or single parents are being impacted more. So just as I was saying, there are those populations that are more impacted here. However, when we talk about mental health, and that's the topic we're talking about, mental health is not just in lower income families or households. You can have anyone with a mental health issue, from a past trauma, from a genetic disposition to it, from a variety of issues. So the mental health component of it can be impacting anyone, regardless of what your income is like. Just that stress that we're all being placed under. And when it comes to foreigners, I think there's different groups of foreigners. If you are American going through this past 12 months, there was a lot of political and racial issues that were being flagged, and that was putting a lot of stress on a lot of Americans. If you were Chinese and you were here in Japan, there was a lot of harassment, and many of them felt they couldn't walk out on the streets. If you are some of the other Asian populations and your families, you couldn't go home. There was a lot of young students here, or some of those demographics where they were impacted by loss of jobs. So when you think about the foreigners, it's a very diverse group of individuals or communities as well. That different resources and different access to information across the various groups.
Okay, thank you.
I think an extension to the mental health piece is that violence affects all classes. It doesn't really, it's not like it happens in certain classes of people. It does make a difference as to how much resource the survivors may have, because obviously if you had money to get a hotel instead of go to a shelter, that kind of thing makes a difference. I also think that vulnerable population is a term that's often used, but I think we have to be careful about who we are talking about when we use that term, because it's not just, if we're talking about class or financial means, it's not just about the people who suffer from poverty. Say, for example, you are affluent, but if you have all the means, for example, but if you have to hide the fact that you're being violated in one way or another because of your social status or your socioeconomic status, or your partner is famous in the community, or whatever, I think that's a type of vulnerability that is often overlooked. So there's all kinds of vulnerability that exists in our society, I think.
Thank you. I'm just going to quickly go through two questions that have come online. And there is one question from Ken Yasaka. And he says, Ms. Koji talked about mental health counseling that is not paid by the National Health Insurance. So this makes it hard for people with some mental health problems to have access to appropriate counseling therapy. Could you please give some information on other countries' system for mental health issues, such as how easily and cheaply people can have access to counseling and support? And how can we learn and introduce these examples?
So every country is different, and I don't think any country has got their health system, including mental health, set up well. But some countries are more advanced in these issues. So if I was thinking about Australia, you can, mental health and counselling support is part of your public health care services. So something like that would be great. Now, the Japanese government is considering introducing counselling to the National Health Insurance Scheme in, I think it's thinking about 2025, I'm not quite sure, it's somewhere around there. It has started that process of beginning to license and regulate the counselling department so that we can say who is qualified to provide appropriate services. So it is changing, but it does need to be better, because medication by itself is not the answer. So medication, a lot of people say, well, I don't want to go on medication, but medication may save you. We wouldn't say to somebody who had cancer, don't go on the medication because it's got bad side effects. We know it's got bad side effects, but it is going to save you. So medication may save you in the absence of anything else. So we need to get over that stigma. But you also need access to counselling so that you learn skills and you learn to repair and you learn to heal and you learn how to cope with these challenges or these stresses or to move forward. So it's not just about medication. Think about if I had a fever, I might need something, or I might need antibiotics to get me well, but I'm going to need rest and I'm going to need some food and other things to get strong again, right? So you need counselling as well. So it's important to have both.
Okay, so that's something that Japan could expand
Absolutely.
the counseling aspect.
Absolutely.
Yeah, thank you very much. Since we are not having much time, I'd like to go to the second question. The name is Rihoko Tsuzura, and she says, I'm diagnosed with PTSD and ADHD before COVID-19 situation. How does symptoms get worse because of COVID-19? Sachi, would you like to, or anybody, Vickie as well, because you have experience with the the counseling aspect.
Do you want to go, Sachi?
You want me to?
No, do you want to do?
Well, let me try, give it a try. I think it goes back to the slide that I had up earlier about how it kind of like burdens your nervous system, is because the previous trauma that you have suffered from abuse or violence, your body's already suffering, because trauma doesn't like disappear like that. Sometimes it stays with us for a long time. I think with me, I think it would stay for the rest of my life. So I would continue to get treatment for the rest of my life, especially when I think about the fact that I'm going to be in this field as my profession. Now, knowing that trauma doesn't lessen automatically with time, like a lot of people assume that it does, then we need to get treatment. And we've been talking about the lack of treatment. We've been talking about lack of training in this country. And then on top of carrying all that with you as survivors, then COVID-19 happens. What does that do to your system physically, psychologically, emotionally? It just really is too much of a burden. That's why a lot of us feel like we can't get up in the morning. We can't do the things that we used to do before. We can't enjoy the things that we used to enjoy. So I mean, there's so many ways to explain that. I'm not doing it justice in this short period of time, but I do think that the COVID-19, the effects of it has worsened many of the survivors' symptoms.
Yes, correct. So when I have PTSD or maybe the ADHD, but if I think about PTSD, so that's a trauma. And as Sachi was saying, when I'm exposed to another trauma, my adrenaline, my stress, my whatever levels are going to spike again. So it's going to bring back that trauma and it's going to elevate my stress levels. Now, if I have ADHD, I may be also struggling with, regulating my concentration and my focus, and maybe I already have a bit of an issue about remaining having those elevated levels, activity levels. So the COVID is putting that stress onto an already spiked stress system, and that is going to exacerbate my ability to focus, to concentrate, to sleep, to remember things. So learning, if you've had PTSD or ADHD, I hope that you're getting some support and treatment. So remembering being patient with yourself and remembering your coping skills, and maybe you need to get some extra support to help you through this period. So yes, you will be more triggered.
Okay, thank you very much. We have time for just one last question. If anybody, yes, please.
Hello, my name is Ashima. I'm from India and I work for the Soka Gakkai. First, I want to say thank you for the incredible work that you're doing at such a difficult time. And as an Indian, I think one thing our community is struggling with is how to maintain our mental health with the information overdose. So we talked about technology earlier, but we need to stay connected on a daily basis to understand how to take care, what we can do to protect our families. So we're facing trauma in 2 countries, Japan and India. And because we really need to stay connected through social media and find out what's happening, it also causes a lot of anxiety, and it's difficult to know when to stop and disengage from media. So what would be some advice to keep our mental health and still stay connected with technology?
Maybe I'll jump in here first. So that's what I was saying earlier about that we're all in this we're all experiencing this traumatic stress response. So it's really important in those early stages, or what's going on with you guys now, is to limit your amount of time that you're spending on your social media, right? You need to have the downtime, right? If you're always looking at it, you're always getting that jolt of stress, right? And that's going to lead you to exhaustion and burnout. So yes, you want to be connected, but you've got to have those boundaries. You've got to limit it. And as Sachi was saying, you've got to put in your regular routines. And your regular routine would not have been checking social media all day. So limit it.
I think I would add to that is that one of the ways that I try, I'm not always successful, but try to control that with myself, is that when I see a headline, for example, on the internet, on a news site, is that I ask myself, is it going to be helpful for me to read this? And I think that often stops me from opening up that piece of article, because I think sometimes I don't realize that I'm doing it just because it's based on my anxiety, or sometimes because of my curiosity. And then I end up feeling worse or more depressed because of something that I have read that I can't unread in my head. So all of us need to start practicing these things. Also, when we stay so focused on social media, meaning the internet, we're glued to computers and smartphones, which means that we're not really moving physically, which is also not healthy. So I think it is important to, and I'm not good at this either, but I try to think of ways to be have some kind of movement physically that is going to automatically remove my eyes off of these screens. So little things, I think, that can be practiced.
Thank you very much. Yes. And Dr. Sakamoto, yeah. No, not really. Yes.
Maybe I'll
Yes.
just say one more. So I run a Lifeline, and I knew going into this that we were going to be under a lot of pressure and stress. So you need to also be thinking, what can I do to take care of myself, right? If I'm going to be there to help others, I need to take care of myself first. So for me, I knew that the media was going to be flooded with these things, and I knew that it was going to be triggering for me. So I would say either to myself, well, I'll look at it in the evening and only in the evening. Or I'm going to connect with people only at these times, and I'm going to have some days where I'm going to switch off altogether. Because if you don't, you're going to burn out. So in order to take care of others, you've got to put some things in there to take care of yourself, right? And that's hard to do when a pandemic's going on and others are struggling.
Okay.
Thank you so much.
Thank you so much. So I want to thank all three speakers for this very pertinent advice. I think we can walk out of this room feeling more ready to face. I mean, there are times when I get really angry with the lockdown and I can't go back home. So that's a kind of stress as well. So thank you so much. It was really wonderful. Please come again. And